For 33 years, December 1st has been recognized as World AIDS Day. AIDS has claimed the lives of 36 million people since being first reported in June of 1981.
Researchers at Mayo Clinic say advances in HIV treatment has actually provided a blueprint in the fight against COVID. But as Team 12's Josh Sanders shows us, the world responded to HIV and AIDS very differently 40 years ago.
Behind these doors, inside the Parsons Center for Health and Wellness in downtown Phoenix, quilts the size of coffins adorn the walls, each representing a person lost to the virus once referred to as the gay cancer.
I've been doing it now for 8 years, bringing the quilts in, and it's like having old friends coming to visit.
Among these old friends is Peter Rodriguez's lover, Paul, and chosen father, Jeff.
He had PML, which is lesions in the brain. At that point, he already has lost most of his faculties. So I really mourned him about 2 years prior to his actual death. I had my gay dad, Jeff, who took me in when I was a runaway. He passed away 2 weeks after Paul did.
Peter has been living with HIV for nearly 40 years, medications allowing him to live with a once certain death sentence. The last 2 years have been a reminder of when he was first diagnosed.
The COVID brought back a lot of memories of the early days of AIDS, being that so many people are passing away.
Scientists at the Mayo Clinic say that decades of HIV research have provided a foundation in the fight against COVID-19.
How to make drugs, how to make vaccines, how to treat virus infection. We're reaping the rewards both in HIV, very treatable disease today, but also in terms of SARS-CoV-2 and the pandemic.
But while COVID-19 has benefited from HIV research, the initial response to both viruses were very different.
It was easy to say that it was a gay cancer back then because that meant only 5% of the population was at risk.
Jimmy Thompson, executive director with the Aunt Rita's Foundation in Phoenix, was diagnosed HIV positive in 2005 and says unlike COVID-19, AIDS was initially looked at as a social issue by the majority of government and medical officials, a virus that only targeted gay men.
It took so long for people to finally pay attention. We see so many variants of COVID-19 already. Consider 40 years of those variants over the course of time.
Today, as Peter and Jimmy remember their friends gone too soon, they hope the blueprint HIV has given COVID-19 will one day soon lead scientists to a cure for a virus that impacts all of us.
It is definitely time to take full action and pay full attention to HIV and AIDS.
Josh Sanders, 12 News.